Welcome back. I'm Connie Carroll, and I am here with the very beautiful Dr. Caitlin Houghton from Hoag Medical Group. Thank you for being here, Caitlin.
Thank you so much for having me.
Dr. Caitlin.
Yes, thank you.
Now, your area of specialty is GERD.
Yes.
Can you explain what GERD means?
Yes, so GERD is gastroesophageal reflux disease. It's commonly known as heartburn. It's very prevalent in the population. So 10% of people have daily heartburn. About 44% of patients or people have once monthly, they have heartburn symptoms at least once a month. So it's very common. So the misconception is that because it's so common, it's not a serious disease, it's not a serious issue. But it actually is. It can become very serious, and acid reflux is one of the main precursors to esophageal cancer.
My goodness.
Yeah, so which is on the rise, and I think most patients don't realize that there's a connection between acid reflux and esophageal cancer.
You know, you don't realize there's a connection because you'll see so many advertisements that will talk about very simple over-the-counter ways to treat any kind of heartburn or acid reflux, and you're saying that it really should be something more looked into than that.
Yeah, for sure, and I think that's also propagating this idea that it's not very severe and that it can just be treated at home. So the main symptoms of acid reflux, as you probably know, are heartburn, but it can also cause dental problems.
Yes.
Yeah,
yes,
if it regurgitates all the way up into the mouth, it can cause adult onset asthma, strictures of the esophagus that lead to dysphagia or difficulty swallowing.
Now, what is dysphagia? That is
difficulty swallowing.
Oh.
So yeah, if you swallow something and it feels like it's getting stuck, it can't go down, that sometimes is acid reflux related as well.
Okay.
So most patients will deal with it. They'll have either Tums in their purse or Rolaids and pop that if they have some symptoms, kind of treat it intermittently. Some patients are on antacids or PPIs.
Yes.
That's very common medication. And it works for patients to decrease their symptoms. The problem with the medications, though, is that acid reflux is really a problem of the valve. There's a valve between the esophagus and stomach.
Oh, it's a valve that you should be looking at rather than anything you're eating or the way you live your life or whether you're behaving or
absolutely.
exercising.
So the valve is weak in patients who have acid reflux. The valve that's supposed to close after you swallow a food bolus usually should prevent reflux of gastric contents up into the esophagus is weak, and so it doesn't close properly.
Oh.
So it's really a mechanical problem of a valve that can't be fixed with medications alone.
Well, it doesn't sound like it could be fixed with medication.
No.
So what is the next step if you really want to check into this?
Yeah, so there are surgical options for acid reflux, which actually address the problem of the weak valve. And the medications can help part of the problem by suppressing the acid, but it doesn't, even if you're on the medications, you have the same amount of reflux, same amount of gastric contents coming up into the esophagus because of your weak valve.
Yes.
And bile and other gastric enzymes can still injure the esophagus, even though the acidity of those secretions are less.
Yes.
So we have two procedures that we offer. There's the old procedure was called a fundoplication or a wrap, and that actually takes part of the stomach and wraps it around the esophagus and creates a new valve.
Yes.
So that was our only option for a really long time, and it's got a bad rap on the internet. Patients get bloating, they have symptoms that they don't like, and so it's really had a bad rap on the internet.
The rap got a bad rap.
Yeah, exactly. So patients don't really want what we had to offer.
Right.
But there's a newer procedure. It's called the links. It's basically a magnetic beads on like a bracelet or a ring that you can place around your weak valve that strengthens the valve so that acid can't, once you swallow, the magnets attract and close the valve for you. so that the gastric contents can't reflux back up into the esophagus. So it really fixes the problem.
That sounds fascinating. So this new treatment, this new type of surgery is called the LINX.
The LINX, yes. It's a same-day procedure.
Really?
Yes, you don't have to stay overnight. It is laparoscopic, meaning small incisions in the abdomen, similar to what you would have for the other procedure that we offer. But you don't have to distort the anatomy on the inside. It's much less invasive.
Yes.
So we're able to just put this little ring right around the valve, and it can help prevent reflux symptoms. And 90% of patients are off medications and don't have symptoms anymore. But the more important part is that you're completely eliminating that reflux from the stomach up into the esophagus. So therefore, you're eliminating the injury from the bile, the acid, and the enzymes.
That is so wonderful, because that's an enormous lifestyle change.
It is. Patients they love being off the medication. They don't have to deal with it.
Of course.
And you don't have to deal, so the connection with the esophageal cancer, if it goes untreated, even if you're on the medications, but you're still having the reflux of the gastric contents up into your esophagus, it can lead to Barrett's esophagus, which is a lesion in the esophagus that's precancerous, like a polyp would be for colon cancer.
Yes.
We remove those all the time when you get a colonoscopy. If they see a precancerous lesions, you get it removed.
Oh my goodness.
Well, Barrett's is the precancerous lesion for esophageal cancer, and it's related to reflux.
Yes.
So if we can treat and get you worked up to see if you have this precancerous lesion, it can be treated before it ever gets to the point of cancer.
And that's so important. And Dr. Houghton, you actually do perform these surgeries.
I do, yes. I have a group, our group at Hoag, there's 3 of us. Myself, Dr. Lippum, and Dr. Bilzikevich. We all perform the same surgeries, and we are trying to get the word out that it's a serious disease, and that people should come and get a consultation with us if they're interested in just knowing their surgical options, so that they don't have to live with it.
Hoag has been such a great partner for us here at Laguna Woods Village as well. So if someone does want to come to speak to your group, they would call you at which number?
Yeah, so our number for the office is 949-764-5350.
Okay, that's 949-764-5350, and you can see that on your screen right now.
Good.
And so if folks in Laguna Woods Village feel that this is a condition that they'd like to check out, either for themselves or for a loved one, they can call that number, and then they'll be able to speak with?
Yes, they'll be able to speak with me or one of my partners about their condition, and just work you up to see how severe your acid reflux is and whether you're a surgical candidate.
That's wonderful.
Yeah.
And then after this surgery is performed and these conditions are addressed, how does the patient's lifestyle change? What do you believe happens?
Yeah, so we've had great results with both procedures. But the LINX, the patients are out of the hospital the same day. Go home, you know, it's still surgery, so there's some pain that you'll have some downtime. But in the end, you're swallowing well, your acid reflux symptoms are gone. You don't have to live with Tums or Rolaids in your purse worried that you're gonna have acid reflux after you eat. And you don't have to worry about it progressing silently without you knowing.
Exactly.
You'll be these patients are also followed up once you're connected with us and have the procedure. We follow our patients and make sure that afterwards that it continues to be the LINX is continuing to work for them, and that they're still having the reflux addressed as the years go by.
It's so wonderful and so important, and some people are even frightened to eat.
Yeah.
It frees you up of all of those fears. Now you can have a normal day again.
The other thing is sleeping. So many patients have acid reflux at night.
Yes.
Where they feel like they have to be propped up on pillows.
Yes.
They can't sleep. They have bile reflux and bad taste in their mouth that even can wake them up from sleep. So it also can help your sleep, which who doesn't want that?
That's true. Well, this is Dr. Caitlin Houghton, who has been with us today, and I am so grateful that you've been here to help us understand more about something that seems like a very simple to fix, over-the-counter kind of condition, but it could be really looked at. So if you are interested, do contact Hoag Medical Group And we have the number. It was 949-764-5350. And you can speak with Dr. Houghton and her group and find out if this is a remedy for you or a course of action for you to take. Doctor, I'm so glad you've been here today.
Thank you so much. Thank you for having me.
Well, we love everyone at Hoag Medical Group, and you are just a wonderful neighbor to us here at Laguna Woods Village. Thank you for being here.
Thank you for supporting us.
Of course. And we will love to see you right after this message. We're going to be hearing from Jennifer Carmarker from our very, very own Globe newspaper, and we're going to get some top headlines, so don't go away.